Hello, my name is David Amuako, graduate student in Health Data Analytics at the George Mason University. Welcome to HAB 725 Statistical Process Improvement case study on complications and death rate at the Inova Fairfax Hospital and competing hospitals in DC. The course is facilitated by Dr. Farrokh Alemi and Dr. Maria Urio of the Department of Health Administration and Policy at the George Mason University. To carry out this case study, data was downloaded from the cms.gov site and utilizing the hospital compare data set for the year range 2015 to 2018. The measures selected were aimed at studying the leading complications of death, which are mostly heart-related in hospitals. These are death from stroke patients, pneumonia patients, heart failure patients, COPD, and AMI patients. Patients and providers can gain useful insight from the analysis of these measures. Like most healthcare data with limitations, the downloaded data had few challenges, which includes missing data and non-applicables, and not to also forget file name change or over certain categories. Overall, I estimate 5% error rate. Inova Fairfax Hospital was chosen because it was one among the major institutions of healthcare facility or hospitals in the Northern Virginia area, and would be of interest to find out how the hospital is faring compared to major facilities in the national capital in Washington, D.C. So in this case study, Inova Fairfax Hospital is compared to hospitals in the DC area, and these are the hospitals: Howard, George Washington, Sibley, Mesta Georgetown, and United Medical. Here are the indicators and analysis. Beginning from indicator 1, Inova Fairfax seems to be doing well with death rate for stroke patients, starting up initially on the grand average level in 2015 and going below the grand average and rightly within the upper control limit and lower control limits. With indicator 2, COPD, Inova Fairfax performance fell within the upper control and lower control limit. However, the indicator picks up from 2015 and goes above the grand average and stabilizes in 2018, inching towards the upper control limits. Indicator 3, AMI mortality, fell within the upper control and lower control limit also. However, a steady decline is observed from 2015 to 2016, but picks back up from 2016 to 2018, going quite below the grand average from the DC competitors. On indicator 4, mortality heart failure fell within the limits, upper control and lower control initially, and further fell from 2016 onwards below the lower control limit, showing a high reduced death rate among heart failure patients at the hospital. Lastly, on indicator 5, pneumonia patient mortality at the Inova Fairfax Hospital shows a performance within the upper control and lower control limits. The indicator starts to fall from 2015 and edging out downwards from the lower control limit from 2017 to 2018. In summary, overall, our hospital Inova Fairfax is well within the control limits when it comes to stroke patients, COPD patients, and AMI patients. With COPD even though it's within the control limit, initially, the rate of the mortality trend is likely to go above the upper control limit if unchecked. For indicators, pneumonia and heart failure, the trajectory looks promising, showing a likely continuous dip in the trend below the lower control limit and showing reduced complications and death rate for Inova Fairfax Hospital. And lastly, to end this presentation on complications and death rate at the Inova Fairfax Hospital versus the DC hospitals, Inova Fairfax is doing quite well compared to its competitors in DC, and extremely so, doing so well, reducing death rate related to heart failure patients. But the hospital needs to keep an eye on death rate related to COPD patients. And this ends my presentation. Thank you.